Very good evening to all of you friends. In this video, we are going to learn about few more things of this topic, cardiac cycle. The first thing we will learn in this video, that is stroke volume. Stroke volume. So friends, your we all know that your cardiac cycle lasts for 0.8 seconds. So the time of cardiac cycle, one cardiac cycle, or we can say duration of one cardiac cycle is 0.8 second. So that's why we have our heartbeat 72 times. If we divide by 60, we will get one cardiac cycle in 0.8 second. So first of all, let's see what is stroke volume. So your each ventricle pumps out blood uh, per cardiac cycle, that is 70 ml of blood is pumped out from your each ventricle. So this is your stroke volume. The 70 ml of blood is pumped by the each ventricle of heart, and this is called as stroke volume. Stroke volume. This is the first thing you have to remember. So if we multiply this stroke volume with your heartbeat, we will get a an cardiac output. So second thing we will learn here, what is cardiac output, which means your stroke volume into the heartbeat. So stroke volume is 70 ml. Your heartbeat is 72. We multiply this, you will get around 5000 ml of blood, which means 5 liter per minute, will be thrown out of your ventricle, each ventricle. So that is your cardiac output. This is the second thing you have to learn here. So the athletes have um, the healthy individual can alter its stroke volume and heartbeat. So and ultimately the cardiac output, and the athletes have more ability to increase this stroke volume and cardiac output, because they are working so hard on their body, so that's why they can increase their stroke volume and cardiac output. Then second thing you have to learn about in this video, that is the sounds of your heart, that is lub and dub. So here I will write, let's see what is lub and dub. So when your heart beats, we all know that your tricuspid and bicuspid valves closes, and the closure of this tricuspid and bicuspid valve is associated with the sound lub. So lub sound is produced during closure of bi and tricuspid valve, and the dub sound is produced with the closure of semilunar valves. And these sounds can be heard by the instrument called stethoscope, which has a high significance in the clinical diagnosis. Stethoscope. So this stethoscope is helpful in hearing these two sounds, lub, which is associated with the closure of bi and tricuspid valve, and dub, closure of semilunar valves. So this is about this video. I have covered all the topics regarding this cardiac cycle. In the next video, we will learn about the ECG and what is electrocardiograph and electrocardiogram. That will be studied in the next video. Till then, please hit the like button if you like this video. Share this video with your friends. Thank you so much.